If it hurts, don't do it. We've all heard this advice before, but sometimes it's dead wrong and actually slows down your recovery. Today we're going to talk about when it's safe to move through pain and when it's not when you're returning from an injury. My name is Dr. Rob Flanagan. I'm a chiropractor here to educate and empower you to own your health so you can do what you love. As always, this is not specific medical advice, but merely general education. If you're struggling with a problem, reach out to a clinician for help. Today, we're going to go over some guidelines from World of Hurt, A Guide to Classifying Pain. And this is a guidebook put together by Melissa Kolsky and Annie O'Connor from the former Rehab Institute of Chicago. First, let's remember that we're meant to move. It's necessary to move for full recovery, and returning to an activity after an injury is a very important step. But it's not always clear how much to do and how soon you should do it. So let's go through an example and talk about the traffic light guideline so we know how to approach this. Let's say you hurt your back the other week. It's improving, but you're still having some pain. You want to get back to running. So you're going to follow that traffic light guideline where you either have a red light, yellow light, or green light. If you have no pain during your run, great. But if you are, you need to follow the traffic guide. So, red light. We kind of all know what this is. You get a big spike in pain, you can't move as well, you lose some strength afterwards, you've re-injured yourself. This is what we all want to avoid, and when deciding to return to, say, running again, you want to start with less rather than more. So there's some guesswork involved here that'd be dependent on, how far you are recovered along, what your previous training was like. But let's say you decide to start with an easy 10-minute run. Hopefully it doesn't cause a red light here. But let's say you do have an increase in pain while you run. Maybe it goes up by 3 points on that 0 to 10 pain scale. 10's the worst. So it goes up by 3 and then it lingers for a day or several. So this would be a flare-up. You probably can still move and function just as well, but you're going to be hurting for the next few days. This will delay your recovery, but it's not actual re-injury. It can be very discouraging and slow things down, but you can get through this. We're actually going to talk about how to deal with flare-ups or yellow lights in the next video. Now let's talk about the best case, where you have some pain during your run, no more than an increase of 3 points on that 0 to 10 scale. But after you're done, 15, 20 minutes later, you're back to your baseline. You're no worse than before. You can still move. Your strength's still there. Day-to-day activities are unaffected. So this would mean you didn't do any harm. And next time you go for a run, you could consider increasing up to 10%. So that would be an 11-minute easy run. Doesn't sound like a lot, but if you gradually get back to activity, you're going to let your tissues heal while you get movement in and speed your recovery. So when reintroducing activity, remember that traffic light system. Avoid the red light for sure. If you hit a yellow light, you're gonna have to calm down for a few days and then get back on track. Green light though, that means try increasing 10% next time. Sometimes you need to go slower, and you can, even if it's 1%, you're still making positive change. So stay tuned for that next video. We'll cover how to deal with those flare-ups.